Hi, these are the instructions for patients who are undergoing IVF at Aspire Fertility Center. Prior to an IVF, there are certain investigations that our doctors might recommend. This might include some blood tests for the lady to make sure her general health is fine, to understand how the ovarian reserve is. There might be a sperm test for the husband. This might include a semen analysis, DNA fragmentation index, and a semen culture. There might be an ultrasound for the lady. This would be helping us assess how the ovarian reserve is, whether there are any cysts, whether there are any hindrances or troubleshooting that we have to do or corrections that we have to do prior to going ahead with an IVF. These tests will help us assess the baseline parameters. In addition to these tests, there will be an infection screening test which is meant for both the wife and the husband. Once the IVF starts, which sometimes it can start on day 2 or 3 of the cycle, sometimes it can start randomly at any point of the menstrual cycle, it would include injections which go on for about 8 to 10 days. Now, these can be 1 injection or 1 shot per day, it could be 2 injections per day, or rarely it can be 3 injections per day. There are several kinds of protocols. The doctor might enlighten you with respect to what kind of protocol that is being used, and these injections are preferably taken in the morning hours before 9:30 in the morning. Aspire Fertility opens around 8 o'clock and injections are preferably taken between 8 to 9:30. Sundays and holidays, yes, the clinic is closed, but however, we have nurses coming in for IVF injections and other procedures. So you can come in at a specified time to get your injections done. Once the 8 to 10 days of injections that are done, there might be 2 or 3 times when the doctor might ask you to come down for an ultrasound. This ultrasound is to monitor and see how the ovarian response is. And once it is deemed that the follicles or the eggs are ready or mature is when a trigger would be planned, and 36 hours from there, a procedure called as ovum pickup would be planned. Ovum pickup is the culminating process of the clinical IVF for the lady, and on the day of ovum pickup, there are certain precautions and necessities that the lady has to take care of, and this will be instructed to you by the nurse from the Aspire or the doctor from Aspire. On the day of ovum pickup, you have to visit the hospital empty stomach, usually at 9 a.m. in the morning. The procedure most often happens somewhere between 11 to 12:30, and this timing can vary depending on the working hours of the clinic. This procedure is done under anesthesia. It's a daycare anesthesia. You should be able to go back home in a couple of hours post the procedure. It would be advisable not to keep any important work or activity for that particular day, and it is important to take a complete day off on the day of ovum pickup. It's done under transvaginal ultrasound guidance, and as it is an ED procedure, you may not notice any scar on your abdomen or around the vagina. On the day of ovum pickup, the husband is also asked to give a sperm sample, and before the patient is discharged, you will be handed over a discharge summary which will have some medications to be taken, and please do follow those instructions correctly. On the day of ovum pickup, the embryologist also will talk to you as to how many eggs have been retrieved, whether we did a intracytoplasmic sperm injection, that is ICSI, or we went ahead with the conventional IVF. You will be getting calls from there on almost every day or alternate day with respect to the outcome in the lab as to how many eggs have fertilized, how they are dividing, how many have cleaved, and how many blastocysts have developed. So day 5 of life is when the embryos develop into a blastocyst stage. A blastocyst is a 100 to 150 celled embryo wherein there is an inner cell mass that forms a baby and a trophectoderm that implants into the maternal womb. At this stage is where the doctor takes a call whether to transfer the embryos in the same cycle or freeze the embryos and transfer in the subsequent cycle. When transferred in a subsequent cycle, it is called as frozen embryo transfer. When transferred in the same cycle of IVF, it's called as fresh embryo transfer. Now, instructions with respect to embryo transfer. On the day of embryo transfer, usually you are called to the clinic around 11 o'clock in the morning, and you don't have to come fasting. It is a simple daycare procedure. You need to hydrate well and keep your bladder comfortably full. This will help not only increasing the ease with which the embryos can be placed inside the uterus, but also gives a good visibility for the doctor to see where the catheter is. Avoid using any soaps or perfumes or any odorous chemicals on the day of embryo transfer, as these chemicals forms VOCs and can affect the survival of the embryos. The procedure of embryo transfer is again hardly 5 to 10 minutes, but however the preparation for embryo transfer may take about 30 minutes or 40 minutes time. It's important to keep your bladder comfortably full, and once the embryo transfer is done, once you rest for about 10 to 15 minutes, you can empty the bladder. You will be discharged the same day with a list of medications that needs to be taken on a regular basis. Usually the pregnancy test time will be around 12 days post transfer for blastocysts and 15 days post a transfer if day 3 or day 2 embryos have been transferred. During this waiting period, it's important that you stay calm, stress-free, and try and avoid any strenuous activities or heavy physical work. In the event that you develop any spotting or pain or fever, do connect with us immediately. A good embryo transfer with grade A embryos gives a probability of implantation of almost 60 to 65%, and this probability can vary depending on the indication of the cycle, depending on the maternal age, which is the age of the lady, and several other factors. It would be a good idea and practice to talk to the doctor with respect to an individualized probability of pregnancy in your unique situation. In the event of failure, it's important to stay calm and have a plan in either eventuality of a positive or negative result of an embryo transfer. If the pregnancy is not achieved at the end of embryo transfer, it is important to discuss with your doctor as to what strategies are available to improvise your chances. There are treatments like endometrial receptivity array testing, parental karyotyping, pre-implantation genetic testing of the embryos, which possibly can be considered in the event that a pregnancy doesn't ensue at the end of an embryo transfer. During the waiting period, it's important to have good diet, adequate rest, adequate hydration, have adequate support, both emotional and physical support at home. Do not stress or strain at work or at home. It's important to make sure that the medications and injections are taken correctly and diligently and on time. Emotional support during this waiting period is extremely crucial, and it's important to seek out support either in the family or join some support groups. In case there are doubts, do clarify, connect with us, and we are here to help you. IVF is a structured and step-by-step process. It's important to be knowing the procedure well so that you can navigate the journey with confidence and clarity.